Did you know that ginger, despite its numerous health benefits, can be harmful to certain individuals? Ginger, that fiery spice we all know and love, has a storied history in traditional medicine, used for centuries to treat a plethora of ailments. But like all good things, it's not for everyone. As much as it's a potent remedy for some, it could be a potent risk for others. Now let's explore the health conditions that can be adversely affected by ginger. First on the list is blood disorders. Now, ginger is a spice that is well known for its health benefits, but it can also increase the risk of bleeding. This makes it potentially dangerous for individuals dealing with blood disorders. Let's dive a bit deeper. Ginger can affect the way your blood clots. For those who don't know, clotting is a crucial process that prevents excessive bleeding when you get injured. Now imagine what could happen if you have a disorder that already affects your blood's ability to clot, and you introduce ginger into the mix. It's a bit like pouring oil onto a fire. Moreover, ginger can react with medications that are designed to affect clotting. This includes common drugs like aspirin and warfarin. So if you're taking these, ginger might not be your best friend. So if you have a blood disorder, it's best to tread carefully with ginger. Next up are gallstones. Ginger, a spice celebrated for its numerous health benefits, can have a less positive impact on individuals with gallstones. You see, ginger has the ability to stimulate the production of bile, a substance crucial for digestion. Now this sounds beneficial, right? Well, not quite if you are grappling with gallstones. Gallstones are hard deposits that form in your gallbladder, a small organ under the liver. When the gallbladder needs to release bile into the small intestine to aid in digestion, these gallstones can get in the way. Increased bile production due to ginger can exacerbate this situation, causing severe pain and other complications. Imagine trying to push a crowd through a narrow doorway all at once. That's what happens when there's too much bile trying to pass through a gallbladder filled with gallstones. The pressure builds, leading to discomfort and even pain. Therefore, if you suffer from gallstones, it's a good idea to avoid ginger. Pregnant? Then ginger might be a no-go. Let's explore why. Ginger, despite its numerous health benefits, is believed to potentially cause uterine contractions. Now this may sound a bit alarming, and rightly so, because these contractions could potentially lead to premature labor or even a miscarriage. Quite a serious concern, wouldn't you agree? That said, it's important to note that research in this area is far from conclusive. Yes, opinions are indeed divided. Some studies suggest that ginger can be beneficial during pregnancy, particularly in managing morning sickness. However, others caution against its use due to the potential risks we've just discussed. This leaves us in a bit of a pickle, doesn't it? Well, when in doubt, it's always wise to err on the side of caution. So, if you're pregnant, it's better to avoid ginger, unless advised otherwise by your doctor. After all, it's your well-being and the health of your little one that's at stake here. Finally, we have heart conditions. Ginger, revered for its medicinal properties, can lower blood pressure and slow heart rate. Now, while this sounds like a boon to most, it can pose risks for those grappling with certain heart conditions. Here's why. When ginger is consumed, it works its magic on the cardiovascular system, potentially causing a significant drop in blood pressure and a slowing of the heart rate. These effects, generally beneficial, can however be a double-edged sword for individuals with specific heart diseases. For instance, those with conditions like bradycardia, a condition characterized by an abnormally slow heart rate, or hypotension, otherwise known as low blood pressure, may find that ginger exacerbates their symptoms. Remember, it's not about demonizing ginger or casting it aside, but rather about understanding its effects on our individual health conditions and consuming it responsibly. So if you have a heart condition, consult your physician before adding ginger to your diet. In summary, ginger, while beneficial for many, can cause problems for those with blood disorders, gallstones, certain heart conditions, and pregnant women. These conditions can be adversely affected by ginger's potent properties. People with these health issues should tread carefully and always consult a healthcare provider before starting any dietary supplements, including ginger. This is particularly important for those with pre-existing conditions. Remember, when it comes to health, one size doesn't fit all. It's always better to be safe than sorry.